My name is David McMaster, and this is Mac on Tobac. Mac on Tobac is commentary on the toll tobacco is taking on those dependent on nicotine from tobacco products, their families, and the community. Previously, we explored smoking cessation and evidence-based practices for helping people wanting to quit successfully. We noted many people believe smoking and smokeless tobacco use is basically a bad habit that needs to be eliminated. In other words, an unwise personal behavior choice. This time, let's examine another approach for dealing with tobacco use that may be considered a medical issue. The issue is the acceptance of nicotine as being addictive. Nicotine dependence is, in fact, a chronic substance dependence disorder and belongs in the same disease category as alcohol and other drug dependence. The medical code for nicotine dependence is 305.10, as listed in the Diagnostic and Statistical Manual used by the medical profession and health insurance companies. Recognizing and accepting nicotine dependence as a disease state and not just an unwise behavior or habit opens new possibilities for intervention and treatment in the healthcare system. It is important to understand there are reliable evidence-based practices for helping people quit tobacco, as we discussed in smoking or tobacco cessation in an earlier view. These evidence-based nicotine dependence treatment practices need to be applied within the context of our established addiction treatment programs and services. It appears short-term smoking cessation methods are not sufficient for those with deeply entrenched nicotine dependence that has resisted many sincere attempts at quitting. Evidence-based nicotine dependence treatment includes effective medication management and skilled counseling and support. These evidence-based practices are fundamental for all diagnosed substance dependence disorders, not just nicotine dependence. The good news is most addiction treatment programs and the professionals that staff them are already well trained in medication management and supportive interventions and treatment practices that they need to use and know how to use. They know how to develop personalized abstinence and harm reduction treatment and recovery plans. Abstinence from tobacco and eventually all nicotine remains the preferred treatment outcome. The sad news is most addiction treatment programs do not treat nicotine dependence as a primary substance dependence disorder. Those with a nicotine dependence disorder that do not have another substance dependence disorder, say alcohol or cocaine dependence, are not eligible for admission anywhere in America to the best of my current knowledge. Until recently, a person with a nicotine dependence disorder, a 305.10 diagnosis, would not have the condition treated in an American addiction program even when they were there for treatment of alcohol and other drug disorders. Only in New York State, some Wisconsin and other state addiction programs is nicotine being treated as a substance dependence disorder of equal concern as alcohol, cocaine, opiates, or other drug dependence. This unhappy addiction treatment dilemma indicates possible malpractice and certainly discrimination when programs best prepared to treat nicotine dependence do not offer available and effective evidence-based nicotine dependence treatment to those that desperately need it. They help patients to get clean and sober, but let them die from the most lethal of all addictions, tobacco dependence. This topic deserves more details and examination. Consideration of smoking and dipping as only a bad habit ignores the brain disease nicotine dependence really is. Thank you for your time and interest in our Mac on Tobac series.